Hi, everybody. I'm Steve with Fitness for Five. Fitness for Five, as you know, if you're on this site, is an online health club membership. I'm here again with Dr. Nario, our usual once a week interview. Dr. Nario with Biointegrative Health Center in Reno, Nevada. You can look them up online and see what kind of treatments and so on they do, or go back and look at any of our mini interviews and pick a topic that seems interesting. So, welcome, Doctor.
Hi, Steve. Thank you for having me again.
Okay, so I want to talk about memory. I mean, you hear a lot of talk about memory and Alzheimer, dementia, and just how important it is and all that. So, what do you think about memory?
Well, Steve, memory is very important for us. The reason for that is we use memory every day in our daily decision making. We think about sports scores, what to wear for a day, tomato or tomato, what are we going to be eating, McDonald's or Burger King. I'm kidding on that part. Well, memory is the ability to understand and internalize information into the memory banks or the stores in our brain. And it's based on the processes of learning, encoding, retention, and then retrieval, and then reactivation of a memory when stimulated or needed. It's almost like putting something in a box, your ability to put it out again and put it in again once you need it. So research says for every fact or memory that or a new learning that we develop, a new brain cell is formed in the brain. So look at that. It's almost like a chicken hatched an egg. So more learning, the better. But here's the thing, we need to keep an eye on specific red flags though. So these red flags occur when somebody develops what we call subjective cognitive impairment. So what is that? Too complicated, isn't it? But to make it simple, these are other people around you seeing errors in your memory, but you are not seeing it. It's almost like you beat the red light and you're saying, I didn't. And you left the stove on. I did not. So these are things that you are not seeing, but other people are. You are still functional and normal. You can accomplish daily tasks. And this may last for maybe 10 years before it gets worse. The worst scenario for this is called mild cognitive impairment, wherein your awareness of your memory problems is now present in yourself and also others noticing it. This is like failing daily tasks. So now you got that ticket from the officer who caught you beating that red light. And oh yes, you burnt your house down when you left that stove on. So these are really tragic events. And majority of these conditions are having like a 5 to 10% conversion to Alzheimer's. The thing here is the misconception about Alzheimer's disease that it's a disease of the 70, 80-year-old. But the truth is, this disease is already starting at your 40s, even up to your 60s, wherein early subtle changes will be seen already as warning signs, maybe through imaging or just your symptoms.
Wow, so yeah, think about it. I guess memory is important. If you don't remember what you wore yesterday, you might wear the same thing again.
Especially underwear, you have to remember to change it.
But nobody would know that, if you wore the shirt, that'd be obvious. So, what is Alzheimer's? And tell us a little bit about it and a little bit about its risks.
Right, Steve, this is a very fearful, I guess, term or diagnosis for everybody who hears it. So Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills and the ability to carry out simple tasks. There are two stages for this. Two types. One is late onset, meaning the symptoms first appear in the mid-60s. So as you can see, it's age stratified. And early onset Alzheimer's occurring between 30 to mid-60s. This is a very rare one. So the late onset one is the more common. And Alzheimer's disease is actually the most common cause of dementia among older adults in that age group. And now you're thinking about what are the causes, possible things that may lead to this. It's anything that's actually disrupting the brain structure or the brain connections. A good example for you would be inflammation. A good one would be diabetes. When you have high blood sugar, You also have high inflammatory deposits of these sugars, and can also lead to high cholesterol that can block circulation. Another one is infection, herpes. So we think always about herpes being in the mouth, but herpes can actually go to the brain, and actually is the more common cause of a virus that is commonly causing cognitive decline. And you would notice that this virus is staying in your brain, the immune system will try to get it, and thus inflammation now happens in the brain. Another one would be trauma, concussions, traumatic brain injuries, like athletes, football players, military veterans, because of the head trauma that they incur because of their profession. Another one would be heavy metals. So a good example again would be lead. So lead likes to stay in the fatty brain, thus altering the functions of the brain. Inorganic compounds, what are those? These are a good example that I will also give to you is the World Trade Center responders. After that incident, the firemen, the people who got exposed to the dust of the building, 15 years after later, has cognitive decline. So another cause is organic compounds. These are pesticides like glyphosate, or the one that we use for Roundup to kill our weeds. And another one, biotoxins such as mold and other infections also that can go to the brain and cause inflammation. And the more common one that you would always hear is vascular, which is strokes, aneurysms causing blood flow disruption. And we go into a more genetic type of connection, which is what we call the ApoE4 gene. So I would suggest you tell your doctor to test for this, especially if you have a high predominance of it in your family tree. Seen on blood tests, so when you have 0 copies, you have a 9% chance of having Alzheimer's. If you have 1 copy, you have 30%. If you have 2 copies, you have 50%. And the hallmark of Alzheimer's is always what we hear, the beta amyloid and tau tangles and the plaques. The basic meaning that I can impart to our viewers here is they are basically physical disruptions or even molecular disruptions in the brain structure in order for those connections not to function properly for memory.
Okay, so you mentioned kind of a broad time range of years. So how would this be diagnosed?
Right, that's a good question, Steve. Everybody wants to know how to pinpoint or put a finger on it, but no single diagnostic test can determine Alzheimer's disease. Medical history, yes, we ask our patients about cognitive and behavioral changes. Most of the time we do interviews with our patients with their families because they're the ones who will see the changes in the specific patient. Neurological exams, we do reflexes, coordination, and speech because that also is affected by Alzheimer's. One that I can actually tell patients that they can do on their own is what we call a mini mental state status exam, or MMSE, and the mini cognitive tests. All can be downloaded through the internet, and these are the two commonly used assessment tools. And for the MMSE, these are just questions of trying to test mental skills, and it's a maximum point of 30 points. That's the highest that you can get. If you get 20 to 24, there's mild dementia, 13 to 20, moderate, and less than 12 indicates really severe. And average score of Alzheimer's declines about 2 to 4 points each year if you do have Alzheimer's or ongoing cognitive impairment. The mini cognitive test, pretty easy to do also. This is just a few tasks for you to remember, and the test will ask you again what they are. And it also will ask you how to draw a face of a clock, all 12 numbers. So we're not going to cheat, or you're not going to draw an hourglass or a digital watch or your iPhone watch, but you're going to make an actual clock. And that's very hard for Alzheimer's patients to do. And the more common one that you will hear would be structural imaging. So this is MRI, CT scans. And the primary use for this really is not to detect direct Alzheimer's itself, but it's really to see secondary changes, such as if there are tumor strokes or damage from head trauma or buildup in fluid in the brain. And sometimes you can even detect amyloid plaques and tau tangles. But again, nothing really can pinpoint where Alzheimer's is and if it's ongoing or not.
So are there different stages? I mean, have there been different stages that have been identified of this disease?
There is, Steve, and let's make it easy for the viewers here, where we're going to make it so simple for them. So early stage of Alzheimer's, which is very mild, you can still function, you can drive, you can work, and be part of social activities. And the thing here is, you might have brain farts or memory lapses, such as forgetting a familiar word or location of everyday objects. Symptoms not be apparent, fully be apparent yet, but family and close friends may notice this already, and even your doctor, maybe through diagnostics or through the physical exams and history taking. And you would notice these people coming up with the right word, trying to like, whatchamacallit, you're using that term a lot and you're snapping your fingers. Remembering names when introduced to new people is very hard. Forgetting material that was just read, or losing or misplacing a valuable object. The key here for this classification is the present memory. It's hard to remember what's going on with the now. And the next one is the middle stage, or the moderate stage. This is the longest stage and can last for years. Symptoms are now more pronounced. Maybe confusing with words that you use. You get frustrated or angry and act in unexpected ways, such as refusing to bathe. Wait, did I just describe myself? No, I'm kidding. Damage to the brain nerve cells, it makes it more difficult to express thoughts and perform routine tasks without any assistance. Symptoms, again, forgetting events or personal history, unable to recall information about self, address or phone number, school where they came from. The key here now is past memory. That's the last one to go versus the present one. And again, sometimes you would see confusion or personality and behavioral changes, and even suspicious behavior and even OCD. And last stage is the severe, which is the late stage Alzheimer's. This is when you lose the ability to respond to the environment, carry on conversation and control movement. May still say words or phrases, but not communicating anymore. And again, the personality is totally different already. And now you are requiring extensive care and requiring around-the-clock assistance for personal daily activities. And again, your physical abilities are changing, especially like sitting and even simple walking.
Wow. Yeah, that doesn't sound good. So what about different prevention methods or treatments for this disease? Can you talk about some of those?
Yes, so Stephen, that's a very important question, because people just want, what can we use to treat Alzheimer's? Unfortunately, there's not much success in the conventional world, for the reason that multiple drugs were trialed and tried, and majority of them failed. Western medicine threw the kitchen sink at it and could not find a solution. A few simple terms here. Namenda, the only one that helped with that trial, but even with minimal impact. Aricept, it does improve in the beginning, but does not work in the long term. And the new drug called aducanumab. Okay, it's kind of hard to remember that, but you don't have Alzheimer's if you don't. It does remove plaques and tangles, but again, it failed in trials and it only slowed the decline of Alzheimer's. So the lesson here is not to have Alzheimer's, but to prevent it. So that's where we come in. And this is what we preach a lot of. So from on our end, this is what we suggest. Use it or lose it. Let the brain be trained. In what way? Continue reading, learn new information, do crosswords, Sudoku, computer, or even your phone games that you be preoccupied with. Even simple calculations. Don't use your calculator on your phone. Do it manually. Write it down. Don't be on autopilot. So make that brain work for it. Another one is, we like to talk about diet here in our segments. The ketogenic diet is the most important one for the brain. So primarily food of the brain is sugar or glucose. But in a demented brain or an Alzheimer's brain, they don't use glucose easy. So they have problems with the receptors. That's why fat is better used for their brain to promote function. It does promote better energy for brain function. And sometimes we also use ketone salts or ketone esters to add more ketones for the brain's usage. Another one, exercise. The only one proven evidence that will promote neuro growth, brain growth, and maintain memory as we get older. It increases what we call the brain-derived neurotrophic factor. I'm not a big fan of exercise. In my busy schedule, it's hard for me to do, but I force myself because of this one reason. This will save my brain. And supplements that we always talk about, magnesium, you can take 200 to 400 milligrams a day, zinc, 80 milligrams once a day, vitamin D, at least 5 to 10,000 IUs a day, glutathione, 500 milligrams once a day, or even NAC. And don't forget, the most important for the brain, omegas. Why? Because omegas are fatty acid based. And again, going back to the ketogenic diet, it produces ketone bodies for our brain to use it as energy. And also it helps build brain tissue because it's fat based as well.
Okay, so I have one more question.
Yeah.
Is there some obvious candidates for prevention?
What do you mean by that? Could you elaborate?
Is there certain people that should be more aware and begin a preventative type treatments for this? Like maybe it runs in their family or
Yes,
something like that. So is there certain people that should be more aware about prevention and start that prevention at an earlier age?
Yeah, so that's a good question, Steve. So when I mentioned to you about the blood test that you can request from your doctor, the ApoE4 gene, you can request for that, especially if your family tree is filled with a high risk of incidence of Alzheimer's conditions, may it be from second, first, or third generation. Another one would be, because it's not always that, it's not a genetically passed on disease. I want to waive that in everybody's mindset. That, oh, I won't have Alzheimer's because my ancestors didn't have it. It can actually be developed. So these are the patients who actually are, you would know, I just mentioned to you a while ago, that has mild lapses, like they're forgetting. They're actually, they're not themselves, especially if you're observing family members whom you know the specific patterns of their activities and like, something's different. So doing the MMSE, and even doing the mini cognitive test through online can be done. And if you think there is a possibility that my brain actually has impaired like circulation or function, such as people who had strokes, people who had brain issues like inflammation, like a brain trauma, those are also higher end people who we need to raise the flag on to keep on watching to see if they develop these specific symptoms of, I'm not specific about Alzheimer's, but just dementia, because dementia, that's where you clip it before it leads to full-blown Alzheimer's.
Okay, great information. Thank you, doctor. That's Dr. Nario, Biointegrative Health Center in Reno, Nevada. Look him up online. Thank you, doctor.
Well, Steve, thank you again. As we all know, the knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.